Do you snore? Well, you may be surprised to learn that there are more people than you might think who snore.
Snoring affects men, women, and children, and it's not a normal part of life. It can signal a serious medical condition, OSA, or obstructive sleep apnea. Member of the American Academy of Dental Sleep Medicine, Dr. Lekha Tull, tells us how custom-designed oral appliance therapy could be a simple solution to help you get the healthy sleep that you need.
Obstructive sleep apnea is a breathing disorder which occurs during sleep due to the narrowing or total closure of the airway. Some of the symptoms of obstructive sleep apnea are loud snoring, excessive daytime sleepiness, fatigue, depression, bruxism, which is grinding or clenching of the teeth, memory loss, increased blood pressure, irritability, anxiety, cardiovascular problems, and waking up unrefreshed. By using a device called a pharyngometer, we create acoustic mapping of the airway. And the best way to diagnose sleep apnea is by a thorough hospital-based sleep study.
Treatment for snoring and sleep apnea is easier and more comfortable than it was in the past.
Obstructive sleep apnea, or OSA, is a serious medical condition that can have a significant impact on the quality of life. It places unnecessary strain on the relationships between bed partners, family, and the workplace. Patients with OSA are 4 times more likely to have a heart attack. 40 to 80% of stroke victims also suffer from obstructive sleep apnea. Although OSA sufferers may experience hundreds of apneic episodes per night, they're unlikely to remember any of them. In fact, if the sufferers live alone or sleep separately, they may not be aware of their condition even after many years. An oral appliance is a small device that's worn in the mouth like a retainer or a mouthguard. It helps prevent the collapse of the tongue and the soft tissue in the back of the throat, keeping the airway open. There are many types of oral appliances. The basic principle by which they work is that they move the lower jaw, tongue, soft palate, and uvula to a position that opens up the airway. Benefits of treating sleep apnea are improved sleep quality, increased energy levels, and alertness. Most patients report that they feel more energized in the morning when they wake up. There have been many studies that show that the risk of cardiovascular disease is reduced after sleep apnea is treated.
I don't think I'd be alive if I didn't have it.
Dr. Lekha Tull and her team, committed to your dental health, your healthy sleep, and give you a beautiful smile that lasts a lifetime. Your smile is an important part of who you are. Does your